Characterized by a high incidence of poverty, food insecurity, and by multiple constraints that have a negative impact on safety, the Sahel is facing various factors that block its development. These range from armed conflict and recurrent droughts and floods that make the populations particularly vulnerable in this region. In this area, nearly half of the population lives on less than $1.25 a day, and over 11 million people are at risk of starvation, and 5 million children under 5 years of severe acute malnutrition.
Si vous vous référez un peu au récent rapport du Fonds monétaire international qui s'appelle World Outlook.
In the recent report of the International Monetary Fund entitled World Outlook, you will see that the poorest countries in the world are in the Sahel. These countries also have the highest fertility rate, and although in recent years we have noticed a downward trend in maternal and child mortality, the population growth rates still remain high, which does not allow the populations to feel a significant improvement of their living conditions.
Population un peu de sentir une amélioration significative de leurs conditions de vie.
In this part of the world, the strong economic growth in recent decades has not resulted in an increase in per capita income or introduced greater equality between the sexes. However, the Sahel could well capitalize on its population, especially the youth who constitute the majority of its population and reap the benefits of the demographic dividend. Thus, the World Bank, the United Nations Population Fund, UNFPA, in partnership with the West African Health Organization, WAHO, have developed a project for the empowerment of women and demographic dividend in the Sahel. Recently launched in Niamey, the project is intended to Burkina Faso, Ivory Coast, Mali, Mauritania, Niger, and Chad.
C'est un partenariat d'un montant global de 205 millions de dollars US.
This is a partnership of an overall amount of $205 million, which will last 4 years. This aims to create the demand to improve healthcare services, maternal, child and newborn health, but also nutrition.
Les services de santé, santé maternelle, santé infantile et la santé néonatale, mais aussi la nutrition.
This program also seeks to assist countries to set up an ambitious program of social communication regarding behavior change.
The
project intends to establish a win-win partnership with the countries in terms of improving the management and supply system of medical inputs regarding reproductive health, maternal, newborn and child health, as well as nutrition.
Concernant donc la santé de la reproduction, la santé maternelle, néonatale et infantile et la nutrition.
Il est question de voir parmi ces 6 pays, il y en a qui sont déjà.
The point is to see that among these 6 countries, some have already agreed with WAHO's KFW, and we'll try to see how we can establish a link. We work with them in reproductive health, and we'll see how we can avoid duplications, so we can have a common objective, which is to increase the outcomes in the long run.
In accordance with Sustainable Development Objectives recently adopted by the international community, the project aims to enable women and girls to be self-reliant and able to make decisions that contribute to the sustainable development of their communities. With its 3 components, the project aims to improve the demand for family planning and maternal and child health services. The second component will develop a regional capacity for securing contraceptives and maternal and child health, as well as the training of health workers. The third component will help empower girls and women in relation to their reproductive health.
L'objectif assigné à ce projet est d'intensifier la production.
The objective assigned to this project is to intensify the production, the extension and the adoption of the best medical practices in terms of reducing fertility in participating countries, and this through actions on the supply chain, which involves the procurement and the distribution of quality products, the availability and the quality of health agents, and actions directed towards the demand, which includes communication on social and behavioral change and the empowerment of women and girls.
Communication sur le changement social et comportemental, l'autonomisation des femmes et des filles.
Il y a un premier volet qui est un volet santé pour s'assurer.
There is a first component, which is a health-related component to make sure women can access health care services. And there's a whole package which involves family planning, which means that all the issues of health-related human resources, which include midwives and their training, so they can be where they are supposed to be, because in some areas there is not a midwife. In Niger, most women are in big cities instead of being in villages where they are supposed to be. Another important component deals with the products of reproductive health, because you might be tempted to tell women, go to the health center. There is ongoing family planning program there. But if the products are not on the spot, this becomes an issue. The point is to make sure that the products are there and that they are quality products and that they can be distributed properly.
Les produits sont de bonne qualité et que les produits puissent être distribués correctement.
In fact, the project for the empowerment of women is a great opportunity for the Sahel in general and for Niger in particular. This country holds the records for the triple rate of the highest natural growth rate of 3.9%, the highest in the world, fertility with an average of 7.6 children per woman, and child marriage that affects 76% of girls married before age 18. The empowerment of women contributes to the eradication of extreme poverty, the achievement of sustainable growth, and sharing the fruits of growth in all segments of the population.
Il va falloir mettre l'accent sur l'éducation, la santé.
The focus should be on education, the health and empowerment of women. If these aspects are not well taken care of, it will be really tough for our societies to develop.
Nous ne pourrons pas aspirer vraiment à un développement réel de nos sociétés.
Des études ont prouvé que le faible taux d'éducation des filles.
Studies have shown that low schooling rates among girls come from their poor origins. And this will help break the poverty cycle in our families and mainly keep girls as long as possible in school, and those who for some reasons dropped out, we have to bring them back to school while ensuring them at least some empowerment.
Tout en leur assurant une autonomie, un minimum d'autonomie.
In most of the countries beneficiaries of the project, national projects have been developed recently with the same goals to reach the demographic dividend and improve reproductive health. This new regional project will therefore help develop national capacities for data analysis, policy formulation related to the demographic dividend, and their implementation.
On verra ainsi donc que la fréquentation de l'école des jeunes filles sera beaucoup plus.
The schooling of girls will be the main focus of policymakers, so parents won't have a choice to decide whether their daughters have to go to school or not, which will be compulsory. Likewise with early marriages. Hopefully, there will be a decrease, or at the very least, the population will keep in mind that an educated girl has a brighter future than an early married girl. I am highly optimistic, and I think that with these demographic dividends, we'll give policymakers the opportunities to reach the development objectives.
La possibilité de pouvoir vraiment atteindre les objectifs de développement.
Nous allons également former les pays. Nous allons aussi les aider à élaborer des messages.
We'll also train countries and help them develop messages which are intended to empower young girls. Messages geared towards behavior change, stopping early marriage, the marriage of adolescent girls, pregnancies in schools. Messages aiming at lifting socio-cultural barriers to the acceleration of demographic dividends.
À l'accélération du dividende démographique.
In the long term, the project objective is, in fact, to support the efforts of participating countries to space birth or even lower fertility rates and achieve the demographic dividend. This should result in an age structure of the population where a larger proportion of working people will generate additional gains for economic growth, just as several emerging countries were able to do.
Il nous faut investir plus dans le capital humain, dans la création d'emplois décents.
We have to invest more in the human capital, in the creation of decent jobs and in good governance. Our respective countries have to work in synergy to address these issues by improving the availability of reproductive health, maternal, child and nutritional services, by strengthening social communication and by sharing their experience and initiatives.
Et en partageant leurs expériences et leurs initiatives.
Il faut poursuivre et accélérer les investissements pour améliorer la santé.
We have to continue and accelerate the investments in maternal and child health, but we also have to improve the offer of service in reproductive health to make sure the number of children per woman can reach a level that can help the different countries mobilize important savings for investment funding.
En tout cas, aux différents pays, de dégager une épargne importante pour le financement de l'investissement. Donc je pense qu'il faut absolument...
So I think that we can work towards transforming the age structure, but these actions also should be followed by investments in terms of education for young people to secure productive jobs.
D'éducation pour que les jeunes puissent avoir des emplois productifs.
The project for the empowerment of women and the demographic dividend will allow 6 beneficiary countries, which are Burkina Faso, Ivory Coast, Mali, Mauritania, Niger and Chad, to accelerate their demographic transition to facilitate the exploitation of the demographic dividend. The acceleration of the demographic transition is therefore a must to engage the demographic dividend, which actually corresponds to the acceleration of inclusive growth that could result from the transformation of the age structure of the population. Because its significant progress is not made on maternal, newborn and child health to strengthen the status of human capital, the Sahel countries risk missing the opportunity for a demographic dividend.